welcome to Brain Chat. I'm Dr. Mitzi Joy Williams, your board certified neurologist and MS specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things MS, health and wellness, advocacy, and we'll even throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Happy Monday, everybody, and welcome to Brain Chat. I'm so excited to be back with you guys. I've been off for the past couple weeks, and we've got a double hitter coming this week and next week. And I'm so excited about the conversations that we're going to have about health equity. As many of you know, this is a topic that is near and dear to me, actually caused me to shift my career to really focus on topics related to how can we improve outcomes in underserved communities. And I'm so excited to have some heavy hitters with me tonight. And I know you guys are going to have a great time with this conversation. As you know, when we start Brain Chat, just log into the chat. Tell me where you are viewing us from, where you are listening to us from. Some people listen on YouTube, Facebook, and I'm so glad you guys took out some time on Monday night to hang out with me and my wonderful guests. I bid you greetings from Atlanta, Georgia, where we have now entered real fall. You know, we don't have seasons here, so we have fake fall, and now we've got real fall. So we're excited about a little sweater weather here, and I hope that everybody is doing well. All right, so go ahead and start telling us where you're logging in from. And while we're doing that, I'm going to start talking about the amazing people I have with me tonight. And I want to get into this discussion. I see somebody's logging in from Oakland in the house. All right, so here we go. So we've got three amazing guests with us tonight. We've got Reggie Ware, who is the CEO of BlackDoctor.org. So grateful for the connection with Reggie, who actually gave us the idea to start the Brain Chat show and reach so many with education. He is the CEO of BDO, or BlackDoctor.org, and he and his team produce culturally relevant health content for Black consumers, as well as anyone else, more than anyone else in the country. They're the largest and most trusted health and wellness destination for Black Americans. Over 15 years of service, and BDO reaches 20 million people per month on its platform, which is really huge. And BDO was really instrumental in providing education to the community, particularly during the pandemic. And that's when I started doing some work with them. So very excited to have Reggie here. We also have Cherie Butts, who is the medical director in research and development. She works at Biogen IDEX since 2012. She has been the clinical lead for beta interferon, which was the first medication or one of the first therapies approved for multiple sclerosis. And she does a lot of work with research, earned her BA and MS degrees from Johns Hopkins, and does a lot of work with clinical research and health equity. And finally, we have Quita Highsmith, who is at Genentech, and she is the first chief diversity officer in the 46-year history of the company, reports directly to the CEO, and she has been very instrumental in a great deal of work focused on health equity, including one of the trials that I work with called the CHIMES trial, which is the first MS trial, phase 4 clinical trial that is focused on Black and Hispanic American people living with MS. So let me bring everybody up to the stage. Reggie, Cherie, and Quita, welcome to Brain Chat.
Thanks for having me. Thanks for having us.
Great to be here.
Listen, this has been a minute in the making, and I am so excited about speaking with you guys tonight. How is everybody doing this evening?
Great.
Excellent. All right. So let's get started. The first question I always ask my guests when they come on Brain Chat is to kind of tell us a little bit about yourself and how you got into the diversity and inclusion space. So I'll start with Reggie.
Okay, great. Hey, well, first of all, thanks for allowing me to be on the show.
Absolutely.
You're doing an amazing job. And, just so the audience understands, I mean, Dr. Mitzi is just as good as you can get in terms of getting treatment for MS. And, for us, one of the reasons that I created BDO, BlackDoctor.org, is because, we've got these great experts that's committed to the people, that's Black, trustworthy, right? And willing and wanting to help the community. So how do we make the connection, right? And so my background has been media. And so I knew that my thinking was that if we could create a platform where people could come and get the information they need, right? That if I can put the experts, if I can put the experts in front of people, I can bring the people to the table, then we can have some incredible dialogue that ultimately will lead to better health outcomes. So that's me.
Awesome. All right, Dr. Cherie.
Now, how do I follow that? So I will say that my road was non-traditional. I am a scientist who transitioned from the lab into the clinic. And frankly, I entered the health equity space because Biden asked. It wasn't something that I purposely was like, okay, today I'm going to do this. You know, when I grow up, I want to be Quita Highsmith. It was more of, you know, we've got a problem. Can you help us out? And I'm really glad that I did it because it, you know, there are things that I was doing personally, you know, working with my church, serving on the health ministry. And then there were things I was doing at work, but I'd never brought the two together. And so now I'm really glad that I found a place where I could bring my work and my passion to elevate my community and make sure that they're getting better and healthier. And so that's where I am right now.
Awesome. Quita.
Hello. First, let me say thanks for having me out here. And as Reggie said, Dr. Mitzi, it's fantastic. She has been giving advice to Genentech for many years now. And so, again, I'm Quita Highsmith, Vice President and Chief Diversity Officer at Genentech. And I have to say, you know, my journey to being the Chief Diversity Office was really in part because of some work that we did when I was previous to this job as the head of patient advocacy for Genentech. And we were wanting to do a patient summit for the organization. And I wanted to include some diverse patients of color that participated in the research. And we could not find one person. So I was like, what happened? Where they at? What happened? That's when I realized, this was in 2017, that very few Black and Hispanic patients were actually participating in the studies. And that led me and a coworker to find Advancing Inclusive Research, which is Genentech's initiative to address barriers to clinical research. And it also led us to put together our Advancing Inclusive Research External Council, which Mitzi has so graciously given us many years of her time, but it's made such a significant difference. And I say that because people in the company, they don't oftentimes know what to do. And oftentimes we are stuck with ideas and items that really we don't pressure test. And it's so great to have Mitzi and the External Council to help us pressure test some of our thinking, our inclusion, exclusion criteria, the way we do our studies, where we go. And so, which led us to do studies like the CHIME study, which is looking at multiple sclerosis in Black and Hispanic people.
Yeah, you know, and it's so interesting because my foray or my entrance into working in diversity and inclusion was also a bit accidental, but I had an aha moment when I met Nicole Richie, who works with Quita. I met Nicole at a conference. Matter of fact, at the National Minority Equality Forum, and so I did a talk about MS in the African American community. I've given talks like this, a lot, since I've been seeing MS patients for the past 15 years or so. And I remember after this particular talk, everybody was like, "Oh, you did a great job. This was a great talk, And I remember going home and saying to myself, nothing has changed. Like, I've been giving the same talk for 10 years and nothing is different. Nothing is better. I don't have any better news to report to anybody. I don't have any breakthroughs to report or any additional, I've got additional data, but it's saying the same thing, that people are doing worse. And so that was really an aha moment for me, to become an agent of change, and so that's how, I wound up starting my own practice and doing all this, stuff. But it wasn't my intention. I didn't come in and say, I'm going to be fighting for, but much like you, Cherie, I saw an issue, and much like you, Quita and Reggie, and I was like, okay, how can I work in my sphere of influence to help solve this issue, or to at least help move the needle forward, so that we're not saying the same thing, 10 more years from now that we've been saying for the past 20 years. So with that in mind, when we talk about health equity, it's a really broad topic. And so I want to start by asking, what does health equity, what does that mean to you? We'll start with, go ahead, Reggie.
Okay, sure. So health equity to me, as I understand it, is the people that need the most help get the most help, right? Get the help they need, so that there's sort of a level playing field, right? Right now, the way society is, the way American culture is, right? Sort of you take care of mainstream America, right? And then you hope that something happens miraculously, and then minorities, underserved population groups start to get some of the help. But that never really happens. That's why when you look at, you were talking about the numbers staying the same, right? Mm-hmm. Blacks, we live sicker and die younger. And that was one of the reasons that I started BDO, because I said, this can't be like this. What can we do differently? And as I hear all of your stories, Cherie, I'm really great meeting you. And Quita, I've known Quita Highsmith, guys. I mean, when you talk about executives, dynamite executives that are just amazing, incredible star power, right? You can't get any better than her. And so, for you guys listening in, I mean, all of these sisters are bad. They're bad. Being able to sit here and listen to these incredible individuals is just amazing. But let me not digress. But it's so significant when you can bring this collection of brain power and expertise and passion. Because as we all told our story, the common thread was initiative. Right. We all saw a need and stepped in, right? And that's pretty amazing. But health equity is, how do we get the people that need it most? Yeah. How do we get them the help that they need, right? Yeah. And for me, as a publisher, as a media person, I'm looking at media, and I'm saying, okay, this mainstream media stuff isn't working. And how do you know it's not working? Well, look at the numbers, right? And so it's not that one size fits all. Different people have specific needs, right? So for us, what we do is, our strategy is to leverage culture, content, and technology, right? To get people the help that they need. So our messaging may be totally different, but it works because we're giving people the help that they need. So from a health equity perspective, how do we look at what the need is and give people the actual need, that they give them the actual service, their actual needs, so that we can all be on the same level in terms of health and happiness and all of that. That requires a lot of different things. So.
Yeah, I love it. I love it. Quita, you want to chime in?
Let me jump in. I think health equity is the opportunity for all of us to get the same treatment when we have sickness and an illness and a disease. And I think inequity in our healthcare system is urgent, especially for Black, Latinx, and other historically marginalized people. And the pandemic showed us and told everybody, laid it bare, right? We were sitting up in the house, but we was noticing who was getting treated, who was getting vaccines, who was dying. When you have the vaccines available in San Francisco, but they not available in Oakland, that's set up by design, right? So the system needs to really think intentionally. And let's talk about patients of color, right? If you've got great healthcare coverage and affordability to have insurance, then life's better for you. But if you've been historically marginalized, right, so you don't have access to medical benefits, right, or you got high co-pays, or you don't have access to fresh foods, because people always say, well, if only people would eat better. Yeah, that's great if you got Whole Foods in the neighborhood, but they not in the hood, right? So you at the corner store where they often don't have fresh fruits and vegetables, right? Or if you in red line neighborhoods where there's not a doctor's office on the corner and you got to drive around town or catch the bus, then you don't have easy access, right? Or you don't have a job that allows you to have time off to go take care of stuff. The financial burden is high for some patients, and we really have to start coming up with some meaningful solutions so that people can get equal access.
Yeah, I love it. I love it, Cherie.
Yeah, so let me see if I can sort of bounce off of what was said before me. Number one, I have to say, BDO is really critical, and Dr. Mitzi, the work that you do is also really critical, because even if we had the right information on the treatments, if we're not telling it in a way that people understand, then it doesn't
Right.
matter.
Right.
And so to me, health equity is really raising health literacy across every community, because a lot of the problem is you see providers and patients kind of missing each other with, I'm speaking one language and you're receiving it a different way. And so to me, that's where there's a disconnect that we really could address. And it seems simple, it's communication, and
Yeah.
yet it happens all day, every day. And then
Absolutely. Go
and
ahead.
then
I
let
will
me
say,
let, and then let me take what Quita Highsmith said, because it's very important. Even if you take people of color living in very good neighborhoods, their care is still not the same. They have a Whole Foods. They have access to commercial insurance. They can get the drug, but their treatment strategy is still not the same as their counterparts. So to me, that's just as wrong as the marginalized communities. And, let's be clear, 70% of the people on welfare are not Black or Latino. And so
girl, you
people
better
can't
let them
say
know
it's
about that
that.
fake news.
So my point is, let's be very careful about
Right.
assuming that
Right.
Black and brown are all poor, and that's why their treatment outcomes and their health outcomes are so dire. Actually, no, it happens even when they're well resourced. They're not getting offered the same options, and to me, that's equity. We've
Absolutely.
got to attack that.
Yeah, there are so many. Ooh, this is so juicy. Okay, there's so many things that I heard that you guys said that stuck out to me. Reggie and Quita, definitely the thought, or Reggie, particularly the thought about meeting people where they are, right? And I think that's something that we all have to think about, and something that we often encounter if you have to be a part of the healthcare system. You have that grounding where you're like, okay, wait a minute now, we got to make this make sense. And so I think that we have to ask the questions to understand what people really need and not assume that we know what they need, because number one, no group of people is a monolith, but we need to ask and not assume that we know exactly what is needed and what the solutions are. And then Quita, you talked about so many things, but particularly in thinking about people's access to care, thinking about issues. I remember talking to a colleague, and they were talking about how they had done a study, focused on how much it cost, or the burden or the cost of just a doctor's appointment. So we're not even talking about participating in a research trial, but the event that we were doing was focused on a research trial, and it was really news to them that it was a great expense to some of their patients to actually get to the doctor, and it was like, wow, this was, and I was like, okay, I knew that, you know what I mean? But we have to make sure that people are aware, and then back to what you were saying, Cherie, many of the people that aren't aware are the people that are caring for people from these different backgrounds and may have different assumptions. I can speak personally. I think of a group that I work with, and it's a group of Black women doctors. And I remember us having a conversation about one of our sister docs who was having some issues. And she was a whole doctor and could not get appropriate care. And people in the circle start calling around and calling friends, and fortunately she had a good outcome. But she could have literally died that night if she didn't have those people connected to call around and call their friends, to get her admitted to a hospital. So again, in thinking about, education level and status, it may allow you to be able to advocate for yourself a little bit more, but does not necessarily guarantee a good outcome. And let's go back and let's piggyback and let's go back to pandemic. So I think, Quita, you brought up pandemic. And so this is a question I want to ask, because I think that one of the things that can be difficult, kind of like when I'm sitting there with my colleague, like, okay, we knew this, it's been going on forever. Many people who've been working in health equity are like, yeah, this has been going on forever, but I think that COVID really kind of shined a light on those disparities, and so how did that really kind of pivot, or I'd like to get each of your opinions on how that really pivoted and kind of energized the conversation surrounding this, and really how has it been an impetus for change?
Can I start?
Yeah, absolutely.
I would say that to your point, absolutely. We all knew that this was a problem. We all knew that the problems that were raised in the news had been around for a while. What made it different is those who had the ability to make a difference and change positively were finally ready. Mm-hmm. Now, one thing I will say that for my organization, they not only said it, they put the money where their mouth was.
Right.
So if you needed to do something, they didn't say no. They said, okay, here you go. Now, I would say that was because of the pandemic, because similarly, they weren't asking me to do this before, but because of what all that was happening over the pandemic, it raised their awareness and their urgency, and they were nice enough to admit to the point that you raised earlier that they didn't know. Mm-hmm. And so they're coming to somebody they think might know. Mm-hmm. And they said, like, what would you do? Because you're a person from one of the communities we see on TV is clearly marginalized. So that to me was really positive, is that the resources were provided where they hadn't been before.
Absolutely.
I would say two things. One, and I think what you were saying, Mitzi, about we have to advocate. That is so important. You may remember there was a doctor in Indiana, I'm not sure exactly the city, who was a Black female who worked at that hospital, mm-hmm. who had COVID, mm-hmm. Hospitalized. They were like, and she was telling them something's wrong, I'm not feeling well. They discharged her. Mm-hmm. 2-3 days later, she came back. Same thing. They were like, oh, you not that bad, you making it up. And she passed away.
She died.
In the hospital.
Yeah. And she was doing Facebook Lives. It was heartbreaking.
It was heartbreaking. And they mm-hmm. didn't believe her. They didn't trust her. And I think those examples highlight that there's a lot of work to be done. And mm-hmm. even if you're a physician at a hospital, they still treat you differently. And so being advocates for our healthcare is just so important. And the other thing I think that we did at our company was we did an actual study where 85% of the study participants came from communities of color, Navajo Nation, Brazil. We went to Kenya for the very first time. And so we were able to recruit Black and Hispanic, Native American people into a study. And there's a lot of fake news in our industry that people of color don't want to participate in the clinical study. Well, we enrolled that study so fast, right? That it's going to be hard. They won't stay on the drug. We can't go into these naive sites. All of that was disproven in the pandemic. Right. So a lot of that fake news, we were able to capture those insights because one, we went to where the patients were, right? Mm-hmm. If we went to Jamaica, Queens. We went to Howard, right? We went to where the patients were. We didn't drop by them and go over to, the fancy institutions. And we really partnered with these sites because mm-hmm. We had a medical world emergency, but that lesson to go where the patients are, to partner with the sites, that's not going away. Right. And so we're taking those lessons learned and we're building them into our protocols. The last thing that I will say that I think is critical is we got to have more Black doctors. Right. I mean, and the data shows that the physician groups of Black doctors is not really growing that fast. Mm-mm. And we have to really ask ourselves why. And I believe there's a lot of institutional racism when they're talking to you as a child. Oh, baby, you can't be no doctor. You got to go here. You got to do something else. We've got to be telling our people and our children, absolutely, you could be a doctor. We've got to help them find that money and that funding and provide them coaches so that they can go through the system and not get dissuaded when they are telling you you're not smart enough, you're not good enough. We've got to be saying to them, you absolutely are. Because I know for me and my family, I only go to Black doctors because I'm concerned for my health. And I know that y'all go hear me. You go listen. You're going to find me some solutions versus some of these other people.
I love it, Quita. I love it. I love it. I love it. Reggie, you want to chime in? You know, I'm burning to say something, but I want to give everybody a chance to chime in if they want to.
Yeah. So sure. Yeah. So for me, looking at it with a wide audience reach, right? So we sort of see things, a little bit different, right? I mean, not different what you got to say because you're spot on, but different from the standpoint of, what do we have to do, the role that we have to play, right? So the good thing about the silver lining with COVID is that it did shine a bright light on health disparities, health equity, and to pharma industry, as an industry, to pharma's credit, they did turn on a dime, right, and did some things right now. And so I think that the awareness level's there, and I think that, and I don't know how long it's going to last. Hope it lasts forever. I don't know, but I think that sentiment changed, right, and that's a beautiful thing. That's the first time in the history of this country that sentiment changed and everybody's on the same page in terms of, I think George Floyd helped as well.
Right.
Everybody got on the same page. Wait a minute, we should be fair with everyone, right? And I was really proud of non-Black people that were committed to change. Ben Franklin, who's considered one of our wisest Americans, had always said that, he said this way back in the 1700s, is that social injustice is never going to change until the people that are unaffected or as outraged as the people that are affected, right? And I think that's what we saw during the pandemic, right? But what was interesting for me is two things. One is the messaging we had to do to get Blacks to understand COVID, right, and then take the necessary actions, which is a vaccine from the government. Right. It was massively different than anything anybody else had to do for their audience, right? So the first thing was when it came down with social distancing, everybody worked from home, right? And great solution, great strategy, but only 10% of Blacks can work from home. So our content wasn't work from home. Our content was, how do you stay safe and go to work every day? How do you stay safe and go to a multi-generational household, right? And then when it came down that, so the solution is vaccination. Oh my goodness. I mean, people were fighting mad, right? And so what we had to do was to get people from, there's no way ever I'm going to get vaccinated to, you know what? Let me protect myself and my family, and I'm going to lead. I'm get vaccinated and so forth, right? And so, and we saw that happen. And as you know, with Blacks, we had to talk about Tuskegee. We had to talk about a whole bunch of things, right? And we're polling and surveying all the time, thousands of people, right? And we were able to see the sentiment change. And so the silver lining is, and we're talking about clinical trials, which, by the way, we just created this clinical trials resource center for Blacks. And I'm hearing some really good stories that we'd like to share on this program, because one of the things we want to do with clinical trials is, what's happened in the past is we send people to a clinical trial. The few that would go, right, we send them off and they're done, right? You never really see them again, hear from them again. People that are, from a marketing perspective, people that send them, right? But what we've created is an environment where we can do warm handoffs, right? A warm handoff. Stay in touch. We're going to support you throughout the entire process, right? And so I think that dialogue, what we found over 17 years, we've been doing it 17 years, is that it's the dialogue. It's people being able to share their opinion and knowing that they got somebody that's going to listen, right? It's the strength of the power of agreement really works, right? And so for us, I mean, we're just seeing a lot of different things happen. But the beauty of the main silver lining from a publishing perspective, immediately from COVID, is that, man, we were able to have some really interesting conversations.
Absolutely.
Conversations,
absolutely.
Right? Absolutely. I got to everything down, because we had to talk about, well, how does the vaccine work? What are the ingredients in it? How can you get a vaccine developed so quick? Right? So we were able to up the level of the conversation, and it worked. So so when people say, you got to dumb it down for the Black community, I'm like, no, you don't. No, you don't. We need to step it up, right? We can have meaningful conversations. So with medicine changing the way it has and progressing in such a very, very powerful and positive way, we've got to get Black people into these clinical trials, right? But we have a really good conversation and explain why. So where I sit, we're in a good spot. Now, the health equity piece, if it were up to me, I've got what I think people should be doing, but bottom line is, I think we're moving in the right direction, and there's a lot to be done, and I think we can make some significant progress here if we keep it up.
Absolutely. Absolutely. And education is so important. And I cannot tell you how many times I directed people to the BDO symposium. You had Fauci on there. You had the doctor who helped create the vaccine in his lab. I mean, I was like, listen, I was sitting there captivated, like, what's coming on BDO today? Let me go see what's, so I can find me some statistics to quote, you know what I mean? So it's so important to create these resources where people can go and learn the basics, and kind of also going back to, I can't remember if Quita or Cherie was saying, making things in a way that people understand, is extremely important, right? And so when I'm sitting there with my patients, explaining to them about disease modifying therapies, I have this horrible picture that I draw and I make rap analogies. I'm like, okay, this is Chuck D, this is Flavor Flav. Okay, this is Busta Rhymes, this is Spliff Star. Or, this is, Steven Tyler, and this is, a roadie. Whatever I need to do, footballs, chilies, whatever I need to do, right?
That's incredibly important.
Yeah, but you got to make it plain where people understand, right? And understand the gravity of what's going on. And I think that so many times, because of sometimes people's prior experiences with the healthcare system and them being brushed off and their symptoms and other things being, discarded, when somebody says, here, take one of these things, they're like, well, what is this? Why should I do this? Ain't nobody paid attention to me before, And so I think that we have to create these resources and help people to understand. And kind of in that vein, I think one of the things that I have really stressed when we talk about health equity, we talk about research, getting people involved, all of these things, I talk about how this is really a collaborative effort, right? And I think one of the mistakes or issues in the past has been sometimes it feels like we blaming the patients for the problem. Well, if you had did this, or if you had did that, or, Black people don't want to be in trials. That's why they're not in trials, right? We have to recognize that this is a global and structural problem and try to focus on ways to ameliorate that from all of these different angles. And so I'll start with you, Reggie. Tell us about, and you kind of spoke to it, but tell us about the role of organizations like yours in educating the masses, right? So the title of this was Health Equity, Educating the Masses, right? Why is this so important, and why is this so urgent that we get people good, solid information, that we get those experts in front of them to talk to them about these issues, breast cancer, whether it's MS, whether it's other diseases? Like, what's the effect, or what's the intended effect of that?
I think the difference, as I look at all population groups and I look at the patient journey of the Black, the difference is this: we have to be really, really strong advocates, right? And if you think about it, every individual is never going to be a strong advocate. So it's not that every single Black person has to be a strong advocate. What we have to do is the leaders within our families, they have to help us. They have to help all of their family members become advocates. For example, I'm sure everybody on this call, if any of our family members have a health issue, they're calling us.
Right.
And they're asking us what should they do, right? And
now, if they listen, that's a different thing. Now, they call, but they may not listen, but they call.
That's another conversation for another time, right? But my point is that we have to become an advocate, because part of the problem is we don't get the best drugs. Like we were talking earlier, you can have health, you can have money, you can have health insurance, but you're still not necessarily going to get the best drug, and it's I call it unconscious bias, with the doctors. But it's just, I mean, the way they equate the value of a Black life is just it's not good enough, right? And so we've got to fill that void, and the only way we can fill the void is to be smart about educate ourselves on the condition and all of those things, the treatment options and so forth. And so from BDO's perspective, man, we drop a lot of time. We spend a lot of time and strategy in how can I get you up to speed in terms of what's going on. And, and when you look at, for example, the name blackdoctor.org, we're a health website, but our name is blackdoctor.org. The Black doctors, right? it's inspiring because we did focus groups on this. We say doctor, the audience would say, okay, well, the group would say, okay, well, somebody smart, don't necessarily care about me, but they're smart. Maybe they know what they're doing. I don't know if they like me. But then you say black doctor, oh, somebody that understands me, somebody's going to get it, somebody's got my best interest in heart, so a role model, all of these characteristics, right? So if you think about it, not only do you have to educate, but it's who the messenger is too. That matters, right? So if you can put those two together with a platform that can reach people where they want to be reached, when they want to be reached, because health is not something that you can just get people to digest at any time, whenever you feel like it. They're going to digest it when they feel like it, right? And so how do you stay top of mind with an audience, right, to give them this really important message? And so I'm talking from a media perspective. So there's a lot of strategy that goes into that, right, and technique and money as well, because it takes money to run a big conglomerate that can reach a lot of people. But the net is, how do we educate the key decision makers in these families so that they can in turn around and help people make the right decisions? And I think that's the holy grail of what we got to do, because the change is going to come from us. Just like we all have the initiative to do something, everyone and the leaders within the families have to take the initiative and say, you know what, I'm going to up my health game, because you're not going to get it from mainstream media. You got to get it from, sorry guys, you got to get it. I'm not going to say we got to get it from BDO, but we've got to get it from the people that we're going to listen to, that we're going to understand, and they're going to feel they got my best interest in heart. Because if I don't think you got my best interest in heart, but believe me, I'm not listening to anything you have to say. I don't care.
Right. And that's so important. And I think that, that's one of the reasons. I think I can't remember who said earlier that we need to train more diverse physician workforce, right? I think that, in the interim, it's going to take some time to train, Black female physicians make up about 2% of, all doctors. So we're very, very small percentage. And so we have to find ways to expose young people to medical disciplines. One of my missions is to increase diversity in neuroscience. So my husband and I created a foundation, that focuses on that. But, everybody didn't grow up like me. I grew up in Atlanta. All of my doctors are Black. My dentist, my oral surgeon, the butcher, the baker, the candlestick maker, everybody, so there were no limits to what I felt like I could do, because I saw everybody that looked like me doing those things, and so it's important that we then figure out how to transfer these areas of knowledge and these experts that we have and expose other people, so that they see themselves in those types of careers, that they know that things like neuroscience are viable careers, and that you don't have to be a rocket scientist, so to speak, to be a neurologist, or what have you. So I think that that's so important. So educating the public to advocate for themselves, that key family member you said that, Reggie, extremely important. Definitely increasing diversity in the neuroscience space. And then what about the role of industry? What is the role of industry in increasing health equity, right? So oftentimes when people think about pharma, they think about money, they think about drugs, but there's a lot of good work that's being done, and we wouldn't have the medications we have if we didn't have companies that conducted trials. So what is the role of industry in increasing or working toward health equity?
Who goes first?
Whoever wants to go. It sounds like you.
Yeah. Okay. I want to pull back from what you said about the workforce, because when I was first asked to do health equity, my division director said, well, how bad are we doing in terms of diversity in clinical trials? And there was this blip of studies, and they said, well, there's these couple studies that they got like over 50% Blacks. Like, what studies are those? Oh, maybe it's lupus. They're like, no, it's MS. Oh, it just happens to be Cherie's. So the irony is I was the medical director for those studies, but none of my investigators were Black. But I think what happened is they saw me and they asked people who look like me. So to Reggie's point about being a decision maker, those investigators may not have looked like me, but the investigators knew I was the decision maker. So they turned around and asked participants who look like me. So that's another mechanism to your point, Dr. Mitzi. We may not be able to fill the room with a lot more neurologists of color. But maybe if we get the right people in decision-making roles,
absolutely,
then all the rest of the ecosystem will follow.
absolutely.
And to your point about industry, my personal view is a couple of things. Number one, I mean, we heard about this with NFL, the screening tests. When you look at screening tests, I mean, I've seen them where it says if Black subtract 8, like that's something we have to work against, is making sure that even a screening test is appropriate, because that might be a way that people are not allowed to participate in clinical research or other activities, or it's giving a false negative. That's number one. Number two, in the vein of clinical research, and as we develop new therapies, we need to be very clear about who is this relevant to, because who did you have in the trial? And so when a patient and a provider sit down and someone says, well, what do people who have my profile, how did they do on this drug?
Right.
We have to be very clear. And as we talked about before, Black is not a monolith.
Right.
So don't assume because you're Black, your scores will be this. You need to really be clear on that. You know, Black people who wear orange shirts on Wednesdays tended to do like this on this therapy. We need to be very clear about what that profile is. So that is our responsibility as people who are making new drugs, new diagnostics, new screening tests. We need to be very careful about not overgeneralizing for certain groups.
I love it. I love it. Quita?
Absolutely. Well, one, you budget what you value, right? So if it's valuable to have a diverse cohort of people in your clinical trial, then the study team will budget for that. They will go to the places where the people of color are, right? So that's number one. I think two, I know there's only 2% Black women, you just said, but we got to have those 2%. They have got to be investigators, right? Because because who is asking you to participate matters in the research. And so, you know, a lot of times we end up going to the same old site, same old investigators, and the system doesn't have the people who are of color participating. So we've got to reach back out into the medical community and say, we want this primary person to lead this study. We need them to be Black. You're doing just that with the CHIME study. And that thing, enrolled faster, went over to Africa. We're going to have some great data. We got a wait list of patients because, you know, before you came along, we were told Black people don't even have multiple sclerosis.
Right.
What? Right? So, like, we've got to put money into it. We've got to find the right investigators. We've got to go to the right clinical sites. But we also, what we call it Genentech, we got to do the 3 Bs. That is, we've got to go to the bishop, to the barbershop, and to the beauty salon to be talking about clinical research. We can't show up on Monday and be like, oh, you want to participate in this cancer study? Think about who are you, right? We've got to be in the community. We've got to be talking to people about the value of clinical research, because there's going to be people in the family, as Reggie said, the family is important, who's going to tell grandma, don't you participate in that cancer study. You don't know what they're giving you. You don't know what you're getting if you just get the regular drug. So we got to be helping them understand the value of clinical research, so that when we come knocking on the door and say, we've got a study that we've highlighted in blackdoctors.org, that people say, yes, I want to participate. So I do think, and we've got to be partnering with trusted advisors like BDO, right? And doing shows like this to say, you know what, if we want to make a real difference for our healthcare, we, Black people, Hispanic people, indigenous populations, we have to also be willing to participate.
Right. Absolutely. All right. So listen, I could talk about this for about 5. You know, I could just give a lecture about this by myself for an hour. So we are running up on the end of our time. And so what I want to do is I want to do a quick round robin and have you guys tell us about at least one initiative in the health equity space that you're excited about, something that you're working on or something that you're excited about. Or an initiative that will help, these populations that you're excited about.
I'm excited. I'm just jumping in. Sorry, guys.
No, go ahead. Go ahead.
Okay. I'm excited about this Clinical Trials Resource Center because I think that the timing.
Tell us a little bit about it. Tell us a little bit more about it, Reggie.
So as we know, when you look at health, I always say our market looks at health through a brown lens, but I think corporations look at not you guys, but corporations as a whole maybe look at health through a blue lens, and there's a disconnect there, right? And it sort of starts with this mistrust versus distrust. A lot of times people look at the Black community and say there's mistrust, but mistrust is I got a hunch something doesn't feel right. I don't know about this. That's mistrust. Distrust is based on history and experience, right? Been there, done that, right? And so I think corporations they mistakenly think that the only thing wrong with Black folks is this mistrust. No, it's distrust. And so to overcome distrust, you got to really, it takes a Herculean effort, right? It takes money, it takes time, it takes experts like you all chiming in and giving great input. And so I just think that, so what we're excited about with the Clinical Trials Resource Center is we're looking at it through a brown lens. And I don't think that's ever happened before, right? And so we got the databases, we have database of patients, and somebody mentioned it earlier on the show, and it was a really important point, which is there are a lot of Black people that want to participate in the clinical trials.
Absolutely.
And people don't realize that, but we've done studies on it. We see the numbers, right? And so what I like about this, what we're doing is it's going to be a different approach, right? We're going to, I like the warm handoff, right? And then, but there's just dynamics that really make it difficult. For example, clinicaltrials.gov, just that name, right? You automatically think, y'all may think that something is not going to be right there, right? And then I heard of a corporation, they were doing something, they got a van and they're driving this van around the Black community, and I'm thinking, well, right now, one of the most popular series is this Jeffrey Dahmer series, right?
Oh, God. Oh, you in the van?
I'm like, oh, no, God. No. So I think we got to get it right? And not understanding, not looking at the world through a brown lens, it's going to be really hard to connect, right? So, I sit and I listen to Cherie, Quita, you, Dr. Mitzi, and I'm like, man, these sisters are so incredibly smart, dynamic, and passionate about getting things done, right? So I'm just, I'm sitting there saying, and Dr. Mitzi, and Quita, too, I don't really do too many interviews, but
I know, I was so excited you came on. So is the database something they can find on BDO's website? Does it tell them about where to find out about trials or?
All right, so here's the way we're setting it up. We are, companies can list through partnership. We want to, and we're working with BCAC, with Dr. Reed Tuckson, right? So we worked together and did so well with getting people vaccinated, right? So we're saying, man, we know the formula, right? We know, understand the process what needs to happen. So we're working together, and then corporations can list the trials on our website, right? Okay. And I think more importantly than anything is, it's a warm handoff. We don't send you there and then that's it. Let's stay in touch, right?
We keep in touch and figure out what's going on.
So that if they have a bad experience, that they can tell somebody about it and something to be done, right? And so, so it's a hands-on, it's a different way, because I think the best way to reach Black folks through the daggone cell phone, the smartphone, right? Guy can be in prison for 10 years, he gets out, the day he's out, he got a daggone cell phone, right? So
he got a cell phone while he in there too.
There you go. Right. So technology has changed, and we can use it to our advantage, right? So those are the things. That's one of the things I'm probably most excited about, because I think we get some good things done here.
I love it. Very exciting. What about you, Cherie?
Yes. So we did some research where we, as you've all talked about, we not only ask the question, we ask the question across the ecosystem. So patients, providers, caregivers, clinical trial coordinators, and we were and even payers, insurance. We were like, we want to understand why is there such a disconnect? And I will say, and we did this in lupus and Alzheimer's, like we went down the line trying to see, maybe it's disease specific. One thing that came out every single time was the fact that for Black and Brown communities, the time to diagnosis was ridiculous. And so the initiative is not just a Biogen initiative. It's an initiative now. I've got partners in every company and everywhere, and even in institutions. They understand that tackling the time to diagnosis, early diagnosis, early treatment leads to better health outcomes, period. So if you even get them diagnosed earlier, that alone is going to make a difference in their outcomes. And so to me, I'm I'm looking forward to that so that we can have a better trajectory of a quality life versus, having MS for years and debilitating. And I remember, Dr. Mitzi, you and I had talked at Enectrums where you were like, people are still getting first line therapies and they're not walking. That makes no sense.
Right.
So really tackling that timely diagnosis and getting it correct, because most of them said they were getting, oh yeah, you got diabetes. You can't have MS because that's a white disease. So things like that, timely diagnosis and correct, that's what I'm excited about.
Huge, huge. And what about you, Quita?
I'm excited that we finally stopped tiptoeing around the issue of race and health inequity in the office, right? Like now we up here, we on this thing, but I'm at the office talking about it all the time because real change starts at home, right? We can't be out here whispering about what we need to do. We need to be out here really committed, investing, being intentional. And the thing that, people are like, well, what's going to happen when we get back out of this pandemic? Or is it going to go back? No, it's not going back because people like me are going to keep talking about it. And we have to be change agents, and we have to keep diversity and inclusion and health equity front and center. But we're not alone, right? When we think about investors now, they're talking about health equity. And so for people that in a thing called ESG, which is environment, society, governance, like investors are now asking questions to companies. And that's when it really gonna matter. When people are like, I'm not gonna give you one dime unless I understand that you are making real change. Because we cannot be praising the power of diversity when underrepresented voices are not in the room. It lacks credibility. And so, I'm excited for us at Genentech because we have our 2025 commitments and we put all of our business on the website. We're saying this is what we're going to do, and we're asking people to hold us accountable. I don't want it to be no secret, because if it's a secret, then can't nobody call us on it. I want to put it out front. I want to be very vocal about it. I want to be intentional. I want us to be seen, because when we're seen, we can get something done.
That's right. That's right. I love it. I love it. And listen, I mean, there's so much I can say about things that all of you said, but I think it's so amazing, the work that each of you are doing in your spaces, and just know that it makes a difference, And I remember as an early, physician, I used to go to meetings and people used to think I worked for the drug company, because there was nobody that looked like me who was a neurologist. And they're like, hey, how long you been working for the company? I'm like, I'm a neurologist just like you, and to now be able to, talk about these issues that I see in my community that are important to the people that I serve, to no longer be the person at the back of the room, like, let's talk about Black people with MS. And everybody's like, oh, nobody want to talk about that. To be able to do things like this is just so amazing and a testament, to the shift in the culture that is occurring. And I think that, if we each in our own spheres of influence, continue to make that difference and continue to do the work, that we will. And I think we already are seeing, the needle shift, and so I think, the message for those that are watching, the patients, the advocates, are to keep moving forward, right? Get the education, advocate for yourselves, for that family member, and know that, the tide is changing, and to not be afraid to, switch gears if you're not getting the help that you need. I know we don't have other doctors on today, but every time somebody comes on, we talk about firing your doctor. So that's like a theme every show. If you're not getting what you need, keep pushing until you get what you need, and hold those people accountable, who aren't doing the right things. And so, with that being said, this has been an amazing discussion. I am so, so grateful for each of you taking out your precious time. I know you all have really busy schedules, and just discussing these very important issues and all the amazing work that you're doing. So with that being said, thank you so much for joining us tonight. And I will see everybody next week for part 2 of our health equity series. We're going to talk a little bit more about clinical research. And we'll see you next week. Same bat time, same bat channel. Thank you, everybody.
Thank you. Thank you all.
Bye.
You got it.